Welcome to this special edition of the Drive Able podcast. My name is Brad Williams, and unfortunately, Ali isn't joining me today. This is a bonus episode. We interviewed Jenny Gribbin in episode number 78. So please go and listen to that podcast episode 78 of the Drive Able podcast, because that is going to lead you into the conversation that we're having today. We've invited Jenny back. Jenny is well known in the OT driving space, and especially for her work with autism. The reason why we've invited her back for a bonus episode, since the recording of her last episode with us, which has just recently been released, there's been a lot of information come out in the media, a lot of media speculation about the impact of changes to the medical guidelines sometime mid last year. What we've done is we've invited Jenny on to come back and have a chat about those changes and what it means for drivers with autism. Really excited to get this going. Can't wait to get this chat underway, and let's invite her in right now.
Welcome to the Drive Able podcast, where each episode you get to listen to two of Australia's leading professionals in the area of driving and community mobility for people with disabilities. In each episode, they interview drivers, carers, and industry experts and share the insider's guide to driving with a disability. Here are your hosts, Brad and Ollie.
Hi, everybody. I'm really excited to get into today's interview. But before we get started, as we do every time, we want to do a quick shout out to our sponsors that make this show possible: Mobility Engineering and Williams OT. It takes a lot of time and money to put this show together, and we are forever grateful for their passion for the industry. Okay, now this is a bonus episode, and it is a follow-on episode from a recent interview that we did with Jenny Gribbin, who's in Queensland, and we consider her to be one of the autism specialists when it comes to OT driving assessments, and we've invited her back. And the reason why we've done that is that we had a bunch of questions that were left unanswered in the last episode, but the main reason why we're looking to get Jenny back onto this podcast episode is that in recent times, there's been some articles published about autism and driving. And we want to discuss what that means from an OT point of view when it comes to OT driving assessments, and maybe help people that are freaking out a little bit that all of a sudden their license may be suspended or cancelled because they're driving with autism. So, Jenny, thank you very much for coming back on. We've called you up at short notice, so I'm forever thankful for your generosity on coming back onto the show. Ali's not here with us today because it is short notice and he wasn't available. But this is an OT specific podcast where we're going to get into the nitty-gritties about autism assessments. So he's given me permission to talk to you without him being here. So let's get into it. Jenny, just a little bit of a recap for people that may not have tuned into the last episode where we had you on. Give us a little bit of a history of yourself and how you're involved in assisting people with autism.
Thanks so much, Brad. Yes, the articles in the media recently have certainly got tongues wagging across the country, and I think we just all need to stay calm. And there's good news, so we'll just preface with that, and we'll circle back. So yes, my name's Jenny Gribbin. I'm a driving OT in Brisbane. My business is called Driving Well Occupational Therapy, and we've been around for 4, 5, 6, something around that years.
But you've been in the industry a lot longer than that. Driving Well was maybe that long, but yeah, we've known each other for a lot longer. So we spoke about all of the tools that you have available on the Driving Well website and how you're assisting people, or you're assisting OTs as well, bringing in these tools to the country that are that were developed by an expert in America.
That's right, Dr. Miriam Monaghan.
Yeah, do you want to give a little bit of a recap real quickly on that one? What
Yeah.
we're going to do is encourage everybody to go back and listen to the details of that
Definitely.
podcast, but just a little review for us.
Yeah, so COVID silver lining, when we had to start working, we'd been working a lot with a lot of young people with autism wanting to learn to drive and other disabilities and neurodiversity and conditions as well. And we weren't as driving OTs, we only knew how to do assessments really in one kind of way, which is what we do for experienced drivers, and it wasn't really working. So when COVID hit, I just started with, how can we do this better, was the question. And I came across Dr. Miriam Monaghan from America, and she had done a lot of work over there in what we call a potential to drive assessment approach. So basically we brought that over here. We've run a whole series of workshops over the last 4 years for all driving OTs and a lot of the rehab driving instructors across the country, as well as bringing the tools that she's developed, bringing them here. So the Drive Focus app, which is an incredible resource that helps with developing visual search and processing skills. And following that, we've been doing therapy programs, and we've got a therapy toolkit available as well. So, and there's a lot more research happening in this space. And over in the States, and starting to do some research here as well, which is really exciting.
Which kind of leads us on to why we've got you onto this podcast. With all of this research that's happening in this area, the Australian medical guidelines, the Austroads medical guidelines, have added autism into the guidelines as a medical condition. Which means that it's now officially recognised as a condition that impacts on driving. Now, it's been around for years. We've been assisting people with autism for many more years than it has been in the medical guidelines. But do you want to talk to us about why this is having an impact and why we're actually talking about this today?
Yeah, so I think just to clarify for all the listeners, so the Assessing Fitness to Drive guidelines is the national document that basically outlines all of the different types of medical conditions, and gives that guidelines to the treating doctor, so usually the GP or the specialist, as to what requirements people need to meet to be cleared for driving. And they might be cleared for driving with an unconditional license, but still report that condition to their state licensing authority, or they might be cleared to drive with a conditional license, which just means that they potentially, there might be conditions that they might need to have a medical review in 12 months' time, or they might need glasses, or they might need XYZ conditions. So it's just important to be aware that autism, all of the hype that's happened in the media is because the media has portrayed this change, in inverted commas, to the guidelines that was published in July last year, 2022, that we're increasing public awareness about that change. But the change is less severe than what's been portrayed, okay? So there was always a neurological section in the guidelines. And if you look back to the previous version of 2016, there was a very small, teeny tiny section that said other neurological conditions, and it didn't say the word autism, but it said developmental disorders.
Yeah.
So it's actually always been in the guideline. What changed in 2022 version was they've amended that section, and they have added the word autism in other neurological sections. So it's become a little more explicit. And the reason for that, is because in practice, Brad, we were, as occupational therapy driver assessors on the ground, we were seeing hundreds, if not thousands of young people in particular, and we're talking more about the learner drivers that were wanting to learn to drive, that they were struggling. Yeah. And there was actual impact of their neurodiverse condition on their ability to drive. So we were seeing this, and we were scared for and concerned for those young people and their parents, family, and public safety. And as an association through OT Australia, when the guidelines were due for review, all of the peak bodies that are involved with that are invited to make a submission into what needs to be considered. So that was one of the key areas that OT Australia and the driving network across the country submitted. And then obviously that was accepted by Austroads to have that added. So it's always been there, but it's more explicit now. And it just says that it's
been labeled. It's been labeled now. Where it was in there before, but it was under different wording. But it's been labeled now. And I think that's really what we just need to understand.
And I think we need to understand that this is a positive thing. Okay. So the guidelines are there for managing safety and preventing terrible, terrible things from happening to drivers and to the public. So it's a positive thing. It's there's been words thrown around that it's discriminatory and humiliating, but I struggle to understand that it's not discriminatory, because every single person in Australia, if they have a medical condition, needs to get the clearance and report it to Transport Office.
Yep.
Right. And it's there to make people safe.
There's a couple of things that come into this, though. Is it a medical condition or is it a disability? And I think that's something that we could argue backwards and forwards, and it's probably not the right time to do it. And I think that's causing some concern in the environment. But I just want to talk about autism. It's actually known as autism spectrum disorder. And the word spectrum is what we've got to concentrate on when it comes to this. Unfortunately, from my point of view, and this is my point of view, what's being portrayed in the media right now is one label fits everybody.
Which is not
autism
correct.
Means that you can't drive. And that's the fear factor that's coming into it. But I'm going to put my hand up, and you would, Jenny, vouch for this. The spectrum is the spectrum. There is so much diversity within the spectrum. And that's where the assessment that we as OTs do is trying to pull out the positives in regards to driving and enhancing those, looking at the negatives and trying to, when I say negatives, the bits that people are struggling with. In regards to maybe it's processing a lot of complex information all at once, reading traffic, trying to understand when you haven't got facial recognition in a car, you're trying to read what a car's going to do, trying to predict what a driver's going to do in a certain circumstance when road rules aren't quite followed. Not everyone with autism has this type of thing, and that's what I'm saying. It's a spectrum, but a lot of clients with autism like predictability and following road rules. And when somebody else doesn't follow the road rules because they take a shortcut or zip through traffic when they shouldn't have, or gone on the orange light when it was turning to red. Someone with autism needs to be able to adjust to that. Like people with non-neurological diversity issues have to do every day when they drive as well. So what I'm trying to say here is that a label doesn't capture what we're actually assessing for. Do you want to add to that at all, Jenny?
I think what you're saying about the spectrum is definitely what we see in practice. So and that's what the potential to drive assessment allows us to find out what that outcome is, and that will put people into one of four buckets. So at one end there'll be where they are very, very high functioning and they don't need specialized support and can continue through a mainstream driving education process, and they likely would not require a condition on their license, and they're off you go and learn to drive like every other neurotypical teen.
And just to relate that, I'm just going to butt in. It's like having glasses on your license. That's a way to think about it. We don't query glasses on a license because you continue to drive in a standard way. But as your eyes deteriorate every 2 years, you may need to go in and get a new pair of glasses. Neurodiversity, you're not really going to deteriorate. So it could be just making sure that tick of approval, recognize that you've gone through a process and you've gone through an assessment to make sure that you are driving according to the standards. So if for that high functioning, if you think about somebody driving with glasses, it's recognized on the license, it's recognized with the Department of Transport, whichever state you're in, and you continue on your normal journey. Normal, that's a terrible word, but on a typical learning process.
And this is the learners that we're talking about. And then the other possibilities with that that assessment are that they're showing potential and readiness for learning to drive now, but there's deficits. There's some, they're struggling with visual search, they're struggling with information processing, all of the things you just mentioned before. And those are the things that could actually impact their ability to learn to drive. So it could be that putting them in a car with a parent puts everyone in a very, very unsafe situation. If mum and dad sees a car coming, they're about to pull out, and they say stop, and the young person can't process that quickly enough and can't brake, crash, right? And if we put these young people in situations where they're, something can happen like that, it's that could cause them significant anxiety, and it could prevent them from pursuing driving when they might have been capable. Or it could prevent the parents from wanting to continue teaching them. So, really be careful about managing these situations. And then some people are going to have disability, quite a severe level of disability because of their medical condition, diagnosis, whatever you want to call it. And that it's just going to be true that either they're not ready yet for learning to drive and they need to go away and do some other work and maybe get a bit older, or they might just not ever going to be a driver, and we need to focus on community mobility, development, work on their independence with life skills and things with that group of young people. But it's reporting to the department doesn't prevent people from being able to learn to drive. It is recognizing that there are some challenges and some struggles because of the condition that they might be impacting on their learning at school, or their ability to go out and be independent in the community, or their ability to have relationships and interact with other people. So if we're seeing these problems, and particularly if they're and most of the young people that come to us are on the NDIS. So if they've met access requirements to be on the NDIS and demonstrating that they are needing those supports, well, then logically, the challenges and struggles that they're having because of their condition are likely to impact on driving.
On the learning process.
On the learning to drive. And remembering that this is a 1-ton metal box, a weapon that can kill people. So the standard is there to encourage people to have that assessment, basically, when they're learning to drive.
Now, this is a bonus episode, so we're going to try and wrap it up and keep it fairly short for listeners, because I'm still going to encourage them to go back and listen to your episode, and we'll put a link down in the description below to find out a bit more details. If you're thinking about your teen or your young adult learning to drive, there's lots of good resources out there, which you shared previously. But let's
talk about the licensed drivers.
Exactly what I was about to say. You took it out of my. What advice would you have for people that have learnt to drive? It's never been registered with the Department of Transport, whichever state you're in, whatever you call it, RMS or which Vic Roads, or here Department of Transport, whatever it is, wherever you are, Department of Transport, whichever state you're in. What advice would you have to somebody that has autism, that went through a typical learning process and it's maybe never been registered with the Department of Transport?
Well, it's a very, very good question, Brad, because we had our Queensland Driving Interest Group meeting yesterday, and I hadn't been aware, but one of the members actually was aware that Austroads, which is that peak body that develops the Assessing Fitness to Drive guidelines, they released a statement last week in response to the media articles.
Okay.
Say that, we'll find the link and we can add it to the show.
Sure, let's do it.
But they basically address that comments and advise that licensed drivers with autism don't need to report to the Transport Authority.
That's really interesting. Austroads is a guiding. This is my opinion. I haven't read the article. This is my opinion based on experience, and working in the industry now for too long, many years. The Austroads set the guidelines. It's now up to each department to interpret those guidelines. From my experience, so SA, where I am, may do it slightly different to Queensland, where you are, and if Ali was here, slightly different to New South Wales, where he is. So it'll be very interesting to see how each Department of Transport interprets it. Austroads are saying, by the sound of it, without reading the article, I'm completely blind here, just based on opinion, that they're suggesting that they don't need to do it because they've got their license. They've shown that they've got their the ability to pass an L's to P's driving test, and that makes sense. It's now going to be very interesting to see how, especially with the media coverage, how the Department of Transports around the country will interpret it in each state. And
I think, the clinical considerations around this are, looking at the big picture for that individual person, right? And so we're thinking about their driving experience and their driving record. So they've got a fairly clean, driving record, that there's not 1,000 accidents or traffic fines that are popping up, because they can be closed that they're not managing driving performance appropriately. We're also talking to them about their driving habits, and we do know that some people with autism that might end up sort of self-limiting their driving because of their confidence that they will only want to drive a certain sort of radius from home or only to familiar locations. And for some people, they might be completely happy with that and it doesn't bother them. And other people, well, it's bothering them. So they want some support to increase their their driving habits. So talking to them about their driving experience. And then thinking about their, one of the key things that we look at with the learner drivers is, and I touched on before, is their life skills. So, if we look at that person that's already licensed, and if they're an independent adult living in the community, they're independent with going out into the community and booking their own appointments and doing this, doing that other thing. Maybe they're working, they have relationships with other people, and they might be on medications, but they might be stable with their medications. That kind of picture of a person is demonstrating that they've got the skills to be a driver, and they don't need to. It's very unlikely that they would need to go through a driving assessment process, and that's one of the things that people are worried about, that's timely and costly. But, as driving OTs, we're saying, well, no, we don't want to be seeing you. We don't have time to see you. There's no need to see those people.
It's not just time, but we actually don't need to do this. You ticked all of the boxes without an in-depth OT assessment, of which we're talking about, where an OT assessment. You can listen to episode 41 where Ali interviewed me about what actually is involved in an OT assessment, about how we pull apart what things people might be struggling with and try to find out why or which part of the body is affecting that, so we can look to overcome those areas. If you're concerned, and I know GPs are absolutely busy and they're absolutely snowed under around the country. However, it's in most states, it's the recommendation of your general practitioner when it comes to a medical condition that advises the Department of Transport. Now, you're probably going to go into your GP practice, and I'm talking about South Australia here because there's mandatory reporting for GPs in South Australia. So the South Australian Department of Transport only really want to listen to doctors. So it's a little bit different in every state. But if you're unclear unfortunately, you're probably going to have to talk to your GP.
Yeah.
And they might put their hands up and go, I don't actually know what to do here. The other thing you can do is actually ask your Department of Transport. Ask your Department of Transport, do I need to do anything about this? I've got my license. I do have autism. And what are the next processes here? The likelihood is that you fill out a medical form with your GP, it gets lodged, and that's the end. That's all
right.
That's all it is.
That's what would happen in Queensland, Brad, is that if, I guess, a lot of these OS roads, this response that was published last week may change things from state to state, but as the current Queensland transport guidelines say, processes are that they would do exactly that. They would have a discussion with the GP. Yes, I've got this condition, but it's not impacting my driving, and the GP would tick the box on the medical certificate form, has a condition but meets the criteria for an unconditional license, take that form into transport, and that's it.
That's it.
And
exactly the same as what happens with my glasses. Yep.
Exactly.
And I can get that reversed with my glasses if I have laser surgery. As an example, I don't need glasses anymore. It can come back off again. It will still be recorded on my license. So things can change over time. It's just a piece of paper to say you've ticked all the boxes to be able to drive. Okay. I just want to say, it is a bonus episode. We're trying to keep it nice and short. I just want to say a massive thank you to you again, Jenny, for coming back on at really short notice, completely unscripted, just us talking about what's recently been going on in the media. What we'll do in the show notes is we'll actually put the articles that we're talking about, the links to the articles that we're talking about. Jenny and I were both contributors to one or two of those articles. So we just wanted to come on and set the record straight from our side and our point of view, a little bit more in depth from an OT assessment side of things. And hopefully this episode has helped understand the medical side of it all without any real hysteria or concerns.
And that it's a positive, Brad. I think that's the key thing, is the media has painted it very negatively, which the media often does. But it, having going through a potential to drive assessment approach or an occupational therapy driving assessment for experienced drivers with other types of medical conditions, to check that their medical conditions not impacting on driving. That's the key thing that we do. Is the medical condition, disability, whatever you want to call it, is it impacting on driving? So, and we're here to help. As occupational therapists, we value function and independence and skill development, and we're about, particularly with our learner drivers, we're about giving them the support and setting them up for success.
So we're just to recap, absolutely right. I 100% agree. It's how we're trained as OTs. We're trying to maximize potential. That's what we do across every area of OT. We Jenny and I and all of the other driver trained OTs out there focus that in on driving and put all of our attention in on driving to try and maximize function. So the assessment process itself might find where you're struggling, but then as OTs, we're trying to maximize potential with what we find. So again, a positive, just to highlight, check with your local departments. There are information on the website with each Department of Transport around the country. Find out what the issues are if you don't report your medical condition. Autism is now considered one of those. If you don't report that or don't have that medical form ticked off, because there could be a fine if it's, let's say you have an accident. For some reason it goes through court. It's found out that you've got autism. A lawyer might say it's not reported, therefore are you driving illegally, and it could snowball into an issue. So our encouragement, well, my encouragement, I don't want to speak for you, Jenny, but my encouragement is that you go and have a look at your local Department of Transport website, and have a look at medical conditions, and just understand what happens if you don't report. So you're making a fair judgment call of whether you need to report it or not. Discuss with the Department of Transport, and then again, maybe discuss with your GP. Okay.
And that part could be as simple as what we've just said before. It's tick the box. Yes, I've got it. Yes, I've got it. No, it doesn't affect me. Hand that into transport. That's it. Yeah. Exactly
right. Yeah. Yep. Absolutely right. It doesn't mean that you have to go and sit an extra test or
that's right.
in stress-inducing environment or anything else like that. I know this is a stress-inducing environment, just being questioned.
Yeah.
But we don't think that you need to go and sit an extra test, but just check with your local departments. That's it. Thanks very much, Jenny. As we say in every episode as we wind this up, I know it's a bonus episode, but just really quickly, and we're not going to ask you about your favorite spot to drive or your biggest driving memory. We've done that, so tune in.
Yeah, we've done that one.
We've done that, but we do want to say a thank you to our sponsors that make the show possible, Mobility Engineering and Williams OT. And I'd stick around for a second. I'm just going to recap the top 3 takeaways by myself really, really quickly. But as we say goodbye, I want to say a massive thanks to Jenny.
Thanks so much, Brad.
All right, welcome back, everybody. A massive thanks to Jenny for coming on. This is a bonus episode, so we're going to try and keep it really, really short. But there's 3 points that I want to make, highlighting what we just spoke about. It's just me today, no Ali. So we're just going to get straight into it. The number 1 takeaway that we've got to start off with is that the changes in the medical guidelines is now labeling autism, but it's really been there for a long time in multiple various versions of the Austroads medical guidelines. But now it's actually got a label. It's actually not too much of a change. It's now been recognized as a condition that may impact on driving. And it's really important to understand that word may impact on driving, because that leads us into takeaway number 2. It's important to remember that autism is a spectrum disorder, which goes from very little impact on driving through to a very significant impact on function, and driving is not even considered. So it's about finding where you fit in that spectrum and what kind of impact it has on driving. Now, it's going to be really easy for a lot of people to just tick some boxes on a medical form to show that it has no impact. You might find that having a chat with your doctor may actually trigger an assessment, because there's been a bunch of accidents which really weren't explained previously. Maybe they may want you to do an assessment, but that actually takes us into dot point number 3. Our suggestion from here, if you've got queries about whether this impacts on you, you've got autism, or it impacts on a family member that has autism, and they are driving already, they've got their license, my suggestion to you is have a chat with your local department to get the clear story from their point of view. And as we said, this is with the media hype at the moment, things may change over the next little bit to respond to that. But have a chat with your local department and find out what the risks are of not registering what's now called a medical condition on your license that may impact on driving. Find out what risks are. Like there's fines with each department if you're found that you haven't registered your medical condition with the Department of Transport, and that varies from state to state. But maybe have a chat with your GP and utilize this episode to help guide you, maybe even guide your GP because this is an evolving space, and get a medical form filled out that's appropriate for your state. So in South Australia, which is where I am, with the Department of Transport and Infrastructure here, it is the MR712 Medical Fitness to Drive form, and it's about ticking on there that you are medically fit to drive with an unconditional license, and that comes from having a chat with your GP. Or if they've got concerns, they might do some investigations. But look, I wouldn't suggest that it's anything to be scared of if you've got your license and you've got a clean record and things like that. Just tick the boxes and make sure that it's registered, so you're not found to be driving maybe technically illegally. Now, I'm not a lawyer, I don't know if that's illegal or not, but we're just putting out the warning there. But I don't think, and Jenny and I both think, that it's nothing to really be scared of, which is unfortunate. The media is actually hyping it up as something to be scared of. So what we want to do now is wind up the episode. Thank you very much to Jenny again for coming on. A quick shout out to our sponsors, Williams OT Driver Assessments and Rehab. We have all the pieces of the puzzle to assist people with their disabilities reach their driving and community mobility goals. And Mobility Engineering is a team of passionate and dedicated people focused on bringing Australia's largest range of suitable transport options for all walks of life. A quick shout out, if you'd like to sponsor this show or know anyone that would like to be interviewed, leave us a comment or questions, or maybe get in contact with us at driveablepodcast@gmail.com. Hit us up on the Facebook page, or just search Drive Able Podcasts, where you can find all of the show notes and all the pieces of information about every episode. We're going to put the links through to the articles that we've discussed in this podcast, the 2 articles that are currently going around with ABC, and another one from Austroads, which we referenced in this interview. But as we say in every episode, the advice provided in this podcast is general in nature. So if you've got any queries about what you can do or what will work for you, or in this case, if you need to go and have a medical assessment, get in contact with your local OT, GP in this case, or your mobility dealer, and set yourself up with a trial, because trials really do put you in the driver's seat. That's it for this bonus episode. Really want to thank you for joining us, and a massive thanks to Jenny again. And if you've got any queries, put some comments down below. We'll try to answer any questions that come through in the comment sections. And let us know how you feel about this, and share this episode with anyone that you think this might be of interest for. That's it. See you in the next episode.
Thanks for listening to the Drive Able podcast with Brad Williams and Aliak Barry. If you like what you've heard, make sure you like, rate and subscribe. It really does make a massive difference. If you or anyone you know would like to share a story about driving with a disability, or you would like to get in contact, find the show notes, or find the resources mentioned in this episode, you can find us on Facebook. Just search @Drive Able Podcast for more information.